Pregnancy is full of surprises. Some sweet, like those first little kicks, and some not so sweet, like morning sickness that lasts all day. But what if I told you that some of the symptoms you are brushing up as just part of the normal pregnancy could actually be red flags? Today we are talking about 5 normal pregnancy symptoms that could be a warning signs and what you will need to do about them. Number 1. Swelling. Let's start with body swelling. Swelling of the feet and ankle. Super common, right? Your body is holding extra fluid, and as the pregnant uterus increases in size, it compresses on your major blood vessels, and this makes return of blood back to the heart difficult, and this causes increased leg swelling. But here is the thing, not all of this swelling is harmless. If you notice sudden or severe swelling in your face, hands or legs, especially if it doesn't go away after resting, it could be a sign of preeclampsia. Preeclampsia is a serious condition that is characterized by increase in blood pressure and appearance of protein in your urine. And this can affect almost all the organ system in your body. And sometimes it can present with persistent swelling, especially of the face and then of the hands. Sometimes leg swelling can just be a normal findings in pregnancy. Most of this leg swelling usually goes after a night rest. But however, if it is persistent, it may be a good time to see your doctor. Second, headaches. Headache during pregnancy, they are the worst. Hormones, stress, and even dehydration can all trigger headaches. But if you are having persistent severe headache, especially ones that feel different from the one that you used to have, or sudden increase of these headaches, it could be more than just migraine. Severe headache can be a sign of elevated blood pressure or preeclampsia. If your headache comes with blurred vision, dizziness, or pain at the lower part of your chest, don't joke with that. Get help immediately. The third symptom is shortness of breath. It is common for pregnant women to feel that the air in the room is not enough. But however, this common symptom sometimes can be a sinister sign for other important red flags. Your growing baby is putting pressure on your diaphragm, making it harder to take breath. But if you are struggling to breathe even when you are at rest, or when you are lying down, or you are having difficulty catching breath at all, it can be a sign of something more serious, like anemia or even blood clot inside major blood vessels. If you experience any of this, don't wait. Please call your doctor immediately and head to the emergency room. The next symptoms is extreme fatigue. Feeling exhausted during pregnancy, that is something that is common. However, growing a tiny human is hard. But if your fatigue is so extreme that you can't get out of bed, or if it comes with dizziness, pale skin, or racing heart, it could be a sign of anemia. Anemia is very common symptoms of pregnancy, and it can affect oxygen supply to your baby. The next one is back pain. Back pain is practically a rite passage during pregnancy. Thanks to your growing baby and shifting of the center of gravity, back pain is very common in pregnancy. But if your pain is severe, especially if it is concentrated on one side of the back, or associated with fever, chills, or pain while urinating, it could be a sign of urinary tract infection. Back pain can be a sign of pyelonephritis, or what we call kidney infection. Sometimes preterm labor can present also with back pains instead of lower abdominal pain. Pregnancy is a beautiful journey, but it is also time to listen closely to your body. If something feels up, don't ignore it. You know yourself better than anyone else. And remember, no caution is too small when it comes to your health and your baby's health. If you ever experience normal pregnancy symptoms that turned out to be something more, share your experience in the comments below. Let's support each other through this incredible journey. Thank you so much for watching. Bye.